Hello friends, let us now go to another question in our series MCQ for you. I'm Dr. Amit Desai, I'm a surgeon and I take lectures for FMGE and NEET PG. So now let us look at next question. A 10 calculus is in the right lower ureter associated with proximal hydroureteronephrosis. Now how will you best treat it? Let us for that see the algorithm for treatment of ureteric calculi. Let us see the algorithm for treatment of ureteric calculi. Now, when we are talking about ureteric calculi, we want to know whether it is completely obstructing, the ureteric system, or it is partially obstructing the ureteric system, partial obstruction. Now, suppose if it has got complete obstruction, now there are two possibilities. If there is complete obstruction, obstruction usually gives rise to infection. So, are we dealing with a person who has got severe urinary infection, or we are dealing with a person who hasn't got a severe urinary infection? Now, if we are dealing with somebody who has got severe infection, then the treatment becomes very essentially emergency treatment, and that is antibiotics and drainage of the urinary system. Antibiotics and drainage of the urinary system. Now, how can you drain this urinary system? There are two ways of draining the urinary system. One is from the above by doing a percutaneous nephrostomy. That means you put a stent percutaneously to drain the pelvis of the kidney, or you can drain it from below, that is by putting a double J stent. By putting a double J stent over. All right. Now, if we are dealing with a person who has partial obstruction or who has severe obstruction, complete obstruction, but not severe infection. Now, here is when we are going to look at the size of the calculus. Now, if the size of the calculus is less than 5 millimeters, then we can think of giving a conservative treatment. We can think of giving a conservative treatment. But if the size of the calculus is more than 5 millimeter, now this is when the location becomes important. Okay, let me write this on the other page because I need more space. So this is where the location becomes important. Okay, so where can the calculus be located in the ureter? It can either be located in the upper 1/3 of the ureter. It can either be located on the middle 1/3 of the ureter, or it can be located in the lower 1/3 of ureter. If it is located in the upper 1/3 of the ureter, you have two options. Either you can do an ESWL or you can do a percutaneous nephrolithotomy. If it is located in the lower third of the ureter, you can do what is known as a ureterorhinoscopy, which means that you will do a ureteroscopic removal. Now, what if it is in the middle third? If it is in the middle third, what you will do is you can decide to treat it in either way. So if you are comfortable doing a ureteroscopy, you can do it, or you can push that ureteric calculus high up into the pelvis and then either do an ESWL or you can do a PCNL. Okay, so this is how you will treat. Now, in the question, they say that it's a large calculus, of course, and that means it is more than 5 millimeters and it is in the lower ureter. So what would you do in that case in that case, you would do a ureteroscopic retrieval. Okay, ureteroscopic retrieval. So that would be our answer, ureteroscopic retrieval. So if you liked this video, please subscribe to our channel ADSL Academics. Please hit the like button and also the bell icon so that you will get notification of all the videos that we are sending to you. Thank you very much.